Hi everyone, welcome back to TYP. And this is a follow-up to our last video, the what to expect when you're getting chemotherapy. And this is about chemotherapy side effects. Ugh, don't we hate that, right? But chemotherapy is one of those necessary evils when you get a cancer diagnosis, right? It does a good job, at least hopefully it does, of killing your cancer, but it can also wreak some havoc on us in different ways. So this video is what to expect post chemotherapy when it comes to side effects, right? And I mean, once again, every chemotherapy is different. Everyone is different. So everybody's going to get different side effects. So this isn't a catch-all. This is just going to be about some things you might experience after you get chemotherapy. And always consult your doctor and your healthcare team. If there's anything that you're worried about or anything that's unusual, or if you get side effects that seem really unpleasant or something that you can't bear with, please, please, please reach out to your healthcare team. Call your doctor, call your nurses, and let them know, okay? Because it's always better safe than sorry. All right. So last video, we talked about what to expect when you first start chemo, right? And sometimes your side effects start as soon as you are in the chemotherapy room while you're getting chemo. That wasn't usually the case for me. Most of my side effects happened later that day after I got home and lasted for several days, or have always been there, right? Have been there since I first started chemo, essentially. And you can get side effects through infusion or oral chemotherapy. Chemotherapy is chemotherapy. Even targeted immunotherapies and stuff like that have side effects. So let's just kind of briefly mention some common side effects that you might see from chemo. So the reason we get a lot of side effects with chemo is a drug, or chemo is a family of drugs, essentially, that target all fast-growing cells in your body, or most chemotherapies do. And fast-growing cells are cancer cells, but there also are hair, skin, and nails. And, some of the lining on our digestive tract is also fast-growing. And that's usually the stuff that's first impacted by the chemo. So when you're looking at side effects, first of all, classic chemo side effect is losing your hair, right? That's kind of what we all think. And when I first started chemo, I'm like, oh, good, I'm going to lose all my hair, right? I didn't lose all my hair. Not everybody loses their hair on chemo, and not every chemo makes you lose your hair. I didn't know this, right? So I'm on gemcitabine now, and you can see this is my actual hair. It's not a wig. I did lose about half of my hair when I first started, when I was on cisplatin combined with gemcitabine. My hair came out fast and furious, and it's all of your hair. It's not just the hair on your head. It's your eyebrows, it's all your hair, everywhere. But I lost about half my hair. It got really thin. And it was much longer than this, actually, when I started chemo. So because it got so thin, I cut it really short because I thought for sure that I'd have to shave it. And I wound up stopping cisplatin before I got to the point of having to shave it. But I did lose a lot of my hair. And a lot of people lose a lot of their eyebrows. There are ways, if it's important for you to keep your hair, talk to your doctor. There are ways that you can keep more of your hair, like cold caps and stuff like that. So if that's important, yeah, ask about it, right? Chemo also really affects your skin. So even today, you might not be able to see with this lighting, but every time I get chemo, I get some bad breakouts. It's usually around here, around my jawline. I get weird dry patches on my skin. Some people get rashes. I get them from time to time. just a lot of skin stuff in general. And I mean, chemo does affect like the oil production and stuff like that in your skin. So like I have weird oily patches here, but like dry patches here. It's just skin stuff in general. Chemo affects that for me in a lot of ways. And your nails, you'll notice, especially when I was on cisplatin, my nails were very, very quick to break. They never got long. They were very thin. And they started getting ridges on them. And actually, I had a ridge for every chemotherapy, every cisplatin dose that I had. Because it just affected the growth of my nails, because nails are fast growing. And that's not all chemos, just some. But yeah, hair, skin, and nail issues, common side effects. You might also hear about mouth sores. I think it's called like mucositis or something like that. But chemo can affect like your lips, your mouth, your mucous membranes in general. And there are ways to help that out. If you're getting mouth sores, talk to your chemo nurses, your infusion room nurses. They can either give you the name of a mouthwash you can use or tell you to do like a saltwater solution to help. The most common side effect with chemo is nausea and GI issues. So nausea's always been, people think of chemo and I think, other than losing your hair, I think they think of nausea, throwing up and stuff like that a lot. And your chemo might not make you throw up, it just might make you feel ill. Or you might not have nausea at all. Every chemo is different, everybody's different, right? But, there are ways to combat that. There are ways to combat a lot of side effects. So talk to your doctor. Be open and honest with them about what's happening to you, right? But nausea is a common one. Ginger is good for that. And staying hydrated. It's often hard. It's hard for me. And I know what to do when I get nauseous, but it's still hard for me to do it. But there is a strong link between nausea and getting enough water, drinking enough. It's hard to drink water when you don't feel well, but if we make ourselves do it, it can really relieve that nausea, staying hydrated in general, right? Other than nausea, diarrhea, or the other spectrum, constipation, very common. Fatigue, big one. I can kind of predict now. I get my chemo on Wednesdays. By Wednesday night, sometimes Wednesday afternoon, it just is like a truck hit you, right? That's how I feel. I feel just, it'll come over me in a wave. It's like all of a sudden just the extreme fatigue. Like I can't get to bed fast enough. Stiffness, soreness in my joints, nausea. And, I've learned that I used to try and fight through it, but I kind of have learned to listen to what my body's telling me to do. And if I am fatigued, I am so tired, take my contacts out, grab a glass of water, and get to bed, right? Because that's how you're going to feel better, is to meet your needs. So fatigue's a big one. And fatigue can last a couple hours. It can last weeks. Everybody's different, right? Some chemos more than others give you a lot of body pain, joint pain, stiffness, general achiness all over. Some chemotherapies make you feel like you have the flu. They give you flu symptoms. Low-grade fever, which you should always call your doctor about, because that could be a big deal. Stiffness, nausea, vomiting, diarrhea, all that, and intense. When I first started cisplatin, intense in my joints, my elbows, my shoulders, my hips, my knees, all got very, very stiff. Also, ringing in the ears, that's an unusual one, but something that might happen. And headaches are very common. Also with my, like, Wednesday night, I feel like I get hit by a truck. I usually get a headache as soon as I start sitting in the infusion chair. It's like as soon as that chemo hits me, I get a headache. And it lasts for a couple days, just like a low-grade minor headache. But that's just something that happens sometimes, you know? And there are ways to combat most of these. There are ways to combat a lot of these side effects now. So if you get, if a lot of them really bother you, yep, you know what to do. Talk to your healthcare provider, right? One thing after I get chemo, I'm always cold for like 3 or 4 days, always cold. It's very weird. It might be a blood flow issue. Numbness is also common. That could go along with the always cold thing. In general, we talked about, you know, usually get your blood work done before chemo to make sure you're in a good place before, because chemo does really affect your blood counts. And what we mean by blood counts is your white blood cells can really drop. And when your white blood cells drop, that just means that you're more prone to infections. So be careful. Don't hurt yourself. Don't cut yourself. That's why they tell you not to shave. Or don't shave with like regular traditional razors. Use electric razors. They just want to cut down on your risk of infection in general. Your platelets can also drop, which means that you're easier to bruise or easier to bleed. That can be serious, you know, but something that you can manage with your doctor. So, you know, more prone to infection, maybe easier to bruise, loss of balance, and kind of a general feeling of clumsiness. This happened to me and is kind of, I mean, it's gotten a little bit better, but still, I feel like a clumsier person in general, and it's very odd. But that is a side effect of getting chemotherapy for some people. And, you know, along with those, like the infection and that, there can be some more serious ones. So loss of fertility, kind of a bummer, right? But for, you know, people more on the younger side of the spectrum getting chemotherapy, this could mean that you're in chemo-induced menopause. You know, for a lot of us, you might stop having a period altogether. You might stop ovulating. And sometimes this is temporary and sometimes it's permanent. So if fertility or, you know, being able to have kids in the future is really, really important to you, I recommend that you talk to your doctor before you start your chemotherapy regimen. And in my case, it was like a 5-alarm fire that we had to put out. We didn't have much time for that. But if I had more time, it's something I would have asked my doctor about. Something I probably would have prioritized before I got chemo. So loss of fertility, that's a big one. In men and women. Affects everybody. So yeah. And some Chemo Brain. Somebody once told me that this is fake. This is not fake. Chemo Brain is real. And what Chemo Brain is kind of a general brain fog and a forgetfulness. And don't let anybody tell you that it's fake, because it's not. Because this might happen to you. It happens to me, right? And I started, before I even knew what Chemo Brain was, I would start chemo and, you know, I don't know, I'd be at work or I'd be talking about work or working from home or something like that. And somebody would be like, remember this last week when we did this? And I'd be like, what are you talking about? I kind of thought that everybody was gaslighting me for a while. But honestly, this can be a side effect of chemo, where just some of your short-term memories just disappear. You might have had a conversation with somebody 3 days before that, and they follow up with you the day after your chemo. And be like, remember what we talked about on Wednesday? And be like, what are you talking about? We didn't talk on Wednesday. It's Chemo Brain. And also just a general forgetfulness, sort of a brain fog, kind of a clumsiness in general. Chemo Brain is real, people. And, I'm kind of laughing about it, but it is kind of serious. Sometimes it can be. Hopefully not, though. Hopefully you're not into any crazy situations where it really affects you very negatively. But I would just suggest that you just write down a lot of important things just to jog your memory. Because sometimes these memories, short-term memories that you lose to chemo brain, aren't gone forever. Sometimes they can come back. But write things down. Write things down that are important. Write yourself to-do lists, especially right after you get treatment. Because, it can be rough. It can be rough on a lot of things. So, yeah, those are some of the common side effects. And I feel like a broken record with this. But I am not a doctor. So talk to your doctor and your healthcare team and your nurses about the side effects and about what is happening with you. They can usually give you some really good tips on how to manage them, or let you know if it's something that you should worry about or if it's just something really common, right? So if you are starting chemo, or if you're going through chemo and you're experiencing a lot of these side effects, I feel you and I understand. And, you're a very strong person to deal with this day in and day out, because not everybody can do it, all right? But, unfortunately, when you're stuck with a cancer diagnosis, we do what we have to do, right? So it's not fun, but, chemo is one of those things in the long run, it's kicking our cancer's butt, right? At least hopefully it is. We've just got to deal with the after effects of it. So if you have any things to share, please do so. And I want to hear from you guys. If you want to talk, or please comment on any of our platforms or email me at terminalyetpurposeful@gmail.com. And if you want to be on the show, or if you want to talk on this show, on this blog, please let me know. I would really be happy to talk to somebody on a video. Or if you just want to do it like a written interview and we post it, that's also great. Whatever you want to do. But I would love to get more feedback and more input from people experiencing the same things. So thanks for hanging with me. Everybody have a good night, and please go do something nice for yourself today, okay? Bye.